So my name is Dr. Chaand Nagpaul. I'm a GP in North London where I've practiced for 34 years. I'm past chair of the BMA Council and I currently also am the board member of the NHS Race and Health Observatory. So I was today talking about inequalities relating to health as they affect ethnic minority communities. And in my talk, I described a range of evidence that shows that for certain medical care and conditions, ethnic minorities fare much worse, but also that it varies according to ethnic group. So some examples that I gave were issues such as cancer, where we see that patients or people from ethnic minorities will often have a delayed diagnosis because they present late. That in turn is often due to the fact there's poor awareness amongst some ethnic minority communities about what signs to look out for, and also lower uptake rates for screening. So there's clearly a work that needs to be done in improving community preventative measures. I talk about mental health as another example where people from ethnic minorities fare much worse in terms of access to mental health services, in terms of the level of mental illness, but also in terms of poorer outcomes. And again, there are factors around communities often feeling that mental health issues are stigmatized and therefore people don't present early enough, but also the service not being tailored and sensitive to the needs of ethnic minorities, so they don't actually feel comfortable to access services. So that's another issue. One of the most striking findings that I shared in my talk was that ethnic minority people with learning disabilities have a life expectancy of just 34 years, which is almost half the life expectancy of a white British person with a learning disability. And we know, according to this research, that the reasons for that halving of life expectancy is because the system does not provide culturally competent and sensitive care, and the needs of many ethnic minority patients with learning disability are being ignored, and they're not getting the right treatment or the right preventative support that they need. I think the other thing that the research showed that I presented is the fact there is a real role for communities to become much more aware of issues related to health that affects ethnic minorities to a greater degree. Much greater awareness and also destigmatizing certain conditions such as mental health, dementia, because we know that for many communities, they don't talk about these things. And as a result, people with illnesses aren't being treated and they're not coming forth to be treated. So there's a lot of work I think that we as communities can do to try and change mindsets. And really what I'd like to see is training for all healthcare staff and that should start at an undergraduate level to understand the whole spectre of ethnic and culturally competent care. You can't sort of just have a one-size-fits-all approach, and most of the key performance indicators, the KPIs that we work to in the NHS, are almost as if everyone's the same. There's no tailoring of our approaches based around the different impact of certain medical conditions and illnesses on different ethnic minorities. So there's a huge amount of work to do, but also a huge amount of research that I feel can also support this change. So I think one of the most important things is to raise awareness amongst policymakers, and by that I mean government, NHS England and integrated care boards, ICBs, that this is an issue. Because in fact, there's huge levels of ignorance that people don't realize that the scale of disparities in health relating to ethnicity. So I think we need to make that argument loud and clear, and then we need to have policies that provide care that is culturally competent and sensitive. Now, actually, this will be of benefit to the NHS, because by providing better care, by creating better outcomes, you're going to also make better use of our total NHS resource and reduce expenses on treating people who become much iller. You can hopefully reduce hospital admissions. You can hopefully also improve outcomes such as heart disease and diabetes complications. So there is a real benefit. And APNA is a fantastic organization to be able to lobby or articulate the sense behind such an approach. Because one of the strengths of APNA is that most of the problems we see in general practice, I think one of the strengths of APNA is that most of the issues that relate to ethnicity and health need to be tackled not just by me as a GP, but by a collective of health and care staff. And today's conference is made up of a range of professionals, people like myself as GPs, physiotherapists, mental health workers, people who are providing community support, and people working in the third sector. So it's that collective approach that's needed, and why I think APNA is really well suited to make that case.